Hi, this is Dr. Tom Rogers coming to you with a weekly Common Sense MD. Today I'm going to talk about something really interesting. I'm going to talk to you about the power of placebo. You know, as a doctor for many, many years, I've always been fascinated by how often placebos actually work. The placebo effect really suggests that your mind can be as powerful as some treatments themselves. The gold standard of any drug trial is called a double-blind placebo-controlled trial. In other words, both the researcher and the patient don't know if they're getting the real drug or a sugar pill. That's what they mean by blinded. And placebo means half of them get the real drug, half of them don't get anything really except placebo, sugar pill. In every trial there is, the placebo works some of the time, at least a third of the time, and sometimes even 60% of the time it works. So placebos have been shown to be most effective for conditions like pain, stress-related insomnia, and maybe even cancer treatment side effects like fatigue and nausea. Those are a lot of the ones that they notice on this, at least. Why does this work so often? Most likely there's a non-pharmacologic mechanism that's in play here. It's a really complex neurobiological phenomenon, and it includes everything from increases in those feel-good neurotransmitters like endorphins and dopamine to greater activity in the brain regions that are linked to moods and emotional reactions and self-awareness. In other words, your brain is telling your body what it needs to do to feel better. Tremendous power in this. In a lot of cases, a placebo will work even if the patient knows they're getting a placebo. And that, to me, that's fascinating. The very act of taking a pill itself can catalyze the body's own capacity for healing. It may be the ritual of doing it, but it definitely sets off some processes in your brain that have been shown through MRIs and PET scans to light up and show enhanced activity in certain parts of the brain when you're given a known placebo. Most of this activity is thought to occur and proven to occur really on these scans in the brain stem. And that part of the brain is really responsible for the autonomic nervous system, like breathing and heart rate. So it's most important there. So, is it ethical to give a patient placebo? Some would say no, especially if it denies that patient a known treatment that will work, that has been proven to work. But in the right circumstances, I think it's useful. And I've certainly done it several times, many times really. In fact, 50% of all doctors do this. So it's not really, in my opinion, unethical if you do it in the right patient and you don't deny them treatment. Actually, a lot of clinical trials have been stopped because the drug works so well. They'll stop it because they don't think it's ethical to continue and deny the people getting the placebo the drug. So when I've done this a few times, I've written for placebo, I write it out as Obicalp, which is really placebo spelled backwards. Every pharmacist knows what that is. I've only done this a very few times when I knew it was going to help and there was nothing pathologic there and no reason not to. So I think it's really interesting that this works. It even gets pretty specific. If people are given an energy pill and told them that will give them energy, then their blood pressure and pulse rate increase. And if they're told, the same people, if they're told that they're being given a pill that will help them relax and sleep, they're given the same pill, what happens? They relax. The blood pressure goes down, pulse rate goes down, they relax. So it definitely works. And the same thing can happen if a patient is told that a placebo could have harmful side effects. They often feel bad afterwards. This is called the nocebo effect. So that's a real effect too. So why am I talking about all this? Really, it's because I think the way doctors approach their patients has a tremendous effect on patient outcomes. Personally, I like to be positive with patients. Think the best, not the worst thing that can happen. Sometimes you have to give patients bad news. And a lot of doctors do it the opposite way. I've heard from so many patients that tell me this or that doctor has told them they don't have a chance. There's nothing that can be done. You really can't practice medicine for as long as I have and not realize that there's a strong emotional aspect to patients' health. And if you're negative, it really hurts the patient. There's a thing called hope that I believe in, and I think it plays a tremendous role in healing, along with good medical science. There's a fine line. That's what makes medicine an art as well as a science. The way you approach things is so important. I think that's one reason why meditation and exercise and strong relationships play such a strong, important role in healthcare. So, what's the message? Stay away from negative people. Negativity is terrible for you, whether it be for your health or just your state of mind. And realize that something can always be done to help you. So I'm a strong believer in the placebo effect because it encompasses so many different ways of thinking about healthcare. There's such an emotional relationship derived factor for healing. And so I think that's important. So think about placebo. Most of the time doctors are not going to treat you with placebo, but certainly these drug trials we do are usually placebo-controlled, blinded studies. And most of the time, placebo works to some extent. So you got to think, why is this happening? And kind of incorporate that into your way of practicing medicine and in the way you think about your own health. So I think this is very important. So think about those things when you're thinking about your health. So make it a ritual to think positive along with your exercise and your routine sleep habits and, of course, great relationships. I mean, there was a huge study done recently that I've talked about before in some of my podcasts about loneliness being as major a risk factor for dying as even smoking. So, there's a strong emotional, mental aspect to healthcare. So I hope you realize this and think positively. Be around positive people. You'll be much healthier because of that. Thanks. I hope this helps you. I'll see you next week.